So Hajar, it's kind of a funny question to ask you as your coworker, but how would you describe your relationship to stress?
Ooh, not very good. No, it's like my constant companion. I'm on good terms with it. I've made peace with the fact that I'm just someone who's a little bit stressed out all the time.
A little bit stressed out all the time is, I think, how most of us feel, to be honest. I think just life in the 21st century, between work and our families and our responsibilities and the stresses of the world around us are just so pervasive that we're all kind of dealing with a level of
Absolutely.
stress at all times. And have you ever thought about how that might be affecting your health?
Well, all the time, because we always hear that stress, manifests in our physical bodies, but not enough, I guess, to make me stop stressing out all the time.
Well, it's interesting because I'd always thought that was sort of a poetic relationship, that was sort of a metaphysical relationship.
Right.
But it turns out that the effects of stress in the body are real, they're physical, they're measurable. And it's something that doctors are actually working on and thinking about in a
Wow.
clinical sense. And obviously, when you're dealing with something like cancer in your life, that only explodes. There's nothing more stressful than getting a cancer diagnosis. And then to pile that on to the normal stresses of being an adult in the 21st century, it's a lot. It's a lot to deal with.
Because then, aside from all the health anxiety that you're probably feeling when you get a cancer diagnosis, I think there's also all these other considerations that make you more stressed, like financials and what are you going to do with your job and all that comes with that.
And your own mortality and how it's going to affect your family and your friends and all these things. And all of that is on top of all that stress that's already there to begin with and exacerbating all of that. This is the podcast Smarter Than Cancer. By the way, my name is David Hoffman.
And I'm Hajar El-Das.
There's actually an entire team of researchers here at Roswell Park working on this question about how stress affects the development of someone's disease when they have cancer. And I had an incredible conversation with Dr. Elizabeth Repasky. She's co-leader of that program here. And it really was eye-opening to me about the connections between the emotional and the physical and how all of that is really present and real and something that has to be considered when you're going through something like a cancer journey.
Research has now emerged in just the past 10 or 15 years, quite recent, that stress hormones are increased over long-term stressors. And unfortunately, the research indicates that those stress hormones actually stimulate cancer growth. I think a lot of people will ask, does stress cause cancer? And then we don't have any evidence for that. What our evidence and that of most other researchers in this field is that it causes cancer to not just grow faster, but become more aggressive. They're more metastatic, and they are often tumors which escape the therapies that we have to treat them. So they become more resistant to being killed. So what am I doing? My research is exploring whether long-term stress affects your immune response against your own cancer. And the answer is unfortunately yes, that long-term chronic stress makes your immune response to your own cancer weaker.
Wow.
And that may be one of the major mechanisms by which being stressed over a long period of time allows a cancer to grow faster.
How do you define the word stress at that biological level? What does it actually mean?
That's a good question, and people have thought about this for many, many years. There's another kind of stress that you might be thinking of, and that's the kind of stress you feel when you're in a hurry and you're late for a meeting, your heart's racing. Something I think we can all identify with is when you're driving and you're not paying attention and the car in front of you stops and you almost hit it. Those types of short-term but very acute stressors are not the type of stress that we're worried about in a cancer patient. Those types of short-term acute stressors have been studied for a long time, and many people believe they're actually beneficial to our health, and having repeated short-term acute stressors may actually be good for us.
Because cardiovascular? Because why?
Perhaps because it stimulates your heart, allows you to become more alert, and they may reflect back in our evolution to escaping a predator. Like if a lion is chasing you, you need to have a rapid increase in your heart rate, blood pressure, muscle function, lung function to run hard and fast. So that type of event is probably in the long run very healthy. What we are concerned about in cancer is that type of stress that is long-standing, something that worries us or is causing us to lose sleep or causing us to feel sadness or depression about an event in our lives. Those are termed chronic stressors because they go on for days and weeks. That type of stress is increasingly believed to help drive the growth of our tumors. And that's the type of stress that worries us the most based on our research. This understanding that cancers are regulated in part by our brain and by things that go on relating to stress. And that is the new understanding we have from the work of people throughout the world. So all of our body is connected to nerves, but we didn't know until relatively recently that tumors are connected to nerves too. That part of the development of a cancer is to get innervated and receive signals from the brain. Other organ systems are harmed by chronic stress. The cardiovascular system is one of them. Tumors get those same stress hormone signals, and in the case of a tumor, it means grow, get stronger, become more resistant to therapy. And maybe that's expected. Maybe we should expect cancers will respond in the same way that a normal organ is, that you're under stress, you're in trouble, get stronger. It's a worrisome possibility, and it is likely that the real role of stress in cancer is to make these tumor cells stronger, just as we respond to stress normally in other organs. That was a major push to this field, and that occurred really within the last 10, 15 years. Psychological stress, for example, we never knew that there could be a direct effect on what you're thinking or worrying about on your tumor.
Wow. You know, it calls to my mind, I think of as kind of unmedical diagnoses of someone dying of a broken heart.
Oh, right.
Their partner went and then they just followed, or, they lost their job and they couldn't handle it. Like, this is almost like physical mechanism for those kind of anecdotal things.
I think you're absolutely right. I've heard about this too. And when I tell people what I do here at Roswell Park, quite often somebody says, I agree with you because I had this experience or that sad experience, or I know of someone that passed away shortly after a very depressing event and long-standing grief. Or people have reported that my patient has experienced a death in the family or had some PTSD-related stress in their life, then gets cancer. And my patient feels that this stress helped help their cancer to appear. What do you think about that? And for decades, people have recognized and have published that stress seems to be linked to an increase in diseases like cancer. I'm also concerned about people that go through a very traumatic event, that the PTSD population out there worries me too, because I think these things kind of reverberate. Even when you're out of the acute stressful situation, it seems to stick with people for years and even decades.
There's a vicious cycle here, isn't there, where what is more stressful than getting a cancer diagnosis? This is the most stressful thing that's ever going to happen in someone's life.
Exactly.
And being a patient, going to, waiting for scans, being in hospitals.
Paying out-of-pocket expenses that you never knew about.
100%. Having to travel to places you don't want to go to.
In the wintertime.
Worrying about your job and your,
Yes.
all of this.
Perhaps feeds very negatively into your own disease, able to make a tumor grow. And yet another bad result of this, it causes people to pick up bad habits like smoking or drinking more or drugs because they are looking for ways to perhaps feel less stressed.
Of course.
And we don't exercise, we eat more. There's so many subsequent events of having a stressful experience, such as a cancer diagnosis, each of which further harms your ability to survive better and longer after a cancer diagnosis. And what can we do about it? So we're interested in all of those things. There are researchers here working on exercise, working on eating better, working on changing attitudes about what we think we need to do to reduce our stress so that we can reduce those harmful habits that people pick up.
This is so interesting. Something that concerns me about this, I worry that if this information goes out to the patient community, okay, you've got this horrible news, your life is completely upended, but it's really important you not get too stressed out about it. That's a heck of a thing to tell a patient.
I agree. I can see your point saying, oh, you have cancer. Don't be stressed about that. And by the way, you need to exercise more. Do you know?
That's more stress, right? Like if somebody telling someone they need to change their exercise routine,
or eating habits or everything.
That's a source of stress, not a relief at first.
Yes, right? I've eaten too much. Yes, I should have exercised, but now I have a big problem.
Right. Let's add guilt. Let's add guilt. On everything else you're dealing with.
Guilt, and that you're hitting exactly one of my bugaboos about cancer. People are afraid to tell each other that they've gotten cancer because somebody will have a reason for why they got it.
Oh, right. Well, I told you shouldn't have been eating at McDonald's. You shouldn't have that. Yeah.
Exactly. Or you smoke too much or you drink too much. And yes, we all know what we should and shouldn't do, but life is not that simple. And it's just very difficult to just get up and face the day and do the best you can. I'm not an MD, but I'm very thankful that other smarter people here at Roswell Park are working ways to physically reduce stress. Quite a few people in the department here called population sciences or epidemiology. They're working on yoga. They're working on identifying what would be a good stress reducing strategy for you, Betsy. You've come in with cancer, but you don't want to run. You don't want to start doing this or that. But what can Betsy do to reduce her stress? So I love the idea of creating portals, so to speak, that even though Betsy doesn't want to start running marathons, I might be interested in yoga, or I might be interested in Tai Chi, and doing something which is low impact at the Y, but I didn't know about that. And so I think that type of intervention at a very personal level is what we are trying to do here at Roswell Park, and I think that's so important. And what we're doing is to test very safe, stress-reducing drugs that can be given to people as they start their cancer therapies. And the one we're very excited about is a long, well-studied, safe, and inexpensive beta blocker called propranolol. And we have an initial small study in patients with advanced melanoma that was extremely encouraging to us. And the patients who took the stress blocking drug were actually blocking the ability of stress hormones to bind to receptors on cancer cells and on your heart and on your lung. A drug like propranolol, which blocks the ability of beta-adrenergic receptors to bind to stress hormones. That's how they work. And we're happy because it's nice to be testing a drug which doesn't further cause toxicity in cancer patients. A lot of our treatments do cause patients to not feel very good. Propranolol has a long history of safe use. And I think another thing that makes me very happy personally is that it's an extremely inexpensive drug. I think the cost that one estimate of our clinical trials here is that propranolol use costs us about 50 cents a day to treat patients with. But what are we doing here? We're only blocking the end result of stress. We still need to work on what's causing the stress in patients because that's not going away. And I think a general definition is it's when you move away from balance, when you move away from what's referred to as homeostasis, and that's the fancy word for when everything is functioning at a good level. You're not breathing hard, you're not worried, you're just in good balance with your environment. So while we may not be able to remove the stress of feeling worried about a cancer diagnosis, our long-term goal is to minimize the impact through our research.
Thanks for listening to Smarter Than Cancer, a production of Roswell Park Comprehensive Cancer Center.
The show is written and produced by your hosts, Hajar Eldas and David Hoffman.
Production oversight by Peter Sosha.
Additional logistics and support from Michelle Eisenstein.
Our production partner for this series is Citizen.
Post-production by Gregory Schweitzer for DCP Entertainment.
Publication and promotion supervised by Candice Chanteloup. If you or your loved one has been diagnosed with cancer and would like to schedule an appointment with Roswell Park, please call 1-800-ROSWELL. That's 1-800-ROSWELL. Or visit us at roswellpark.org.
If you're enjoying this series, we'd love to hear from you. Please reach out and tell us about your cancer story, and let us know what topics you'd like us to cover in future episodes by filling out the form at roswellpark.org/.
And if you know someone else who might find value in what we're doing, please tell them about it. You can listen and subscribe wherever you get your podcasts.